and welcome to this information session on the UCL Online Master of Public Health program. In this session, we're going to introduce ourselves as the co-directors of the MPH program, give you a presentation about some of the key information about the program, and then just do a little bit of a Q&A at the end of some of the key points which you might want to know. So over to you, Denis.
Hi, everyone. My name is Denis Steffler. I'm a lecturer of epidemiology here at the Institute of Epidemiology and Healthcare at UCL. I have a medical background, but have been working in academic public health for more than 15 years now. I did my PhD here at UCL, and my research interest focuses primarily on nutritional epidemiology, looking at the relationship between dietary habits and health, especially in Eastern European context, but in other geographical areas as well. In terms of the MPH, I'm one of the program directors of the program, together with Serena, and I also lead a number of modules, including the applied epidemiology module and the dissertation module.
Great. My name is Serena Luchensky, and I'm a clinical associate professor here at UCL. I've been here since about 2015. I'm a co-director, as Denis said, of the MPH program, and I'm also a public health specialist by background, or a consultant as we're known in the UK. My main interests in terms of my research are around homelessness and inclusion health, and I work in a variety of different areas working with marginalised populations. In terms of my teaching interests, you'll see me in the fundamentals of interdisciplinary public health in term 1 of the program, as well as in the health protection module in term 2. So now I'm going to just give you a brief presentation about some of the key information of the program, and then, as I said, we'll do a bit of Q&A at the end. Right, so I'm just going to now talk you through a little bit about the essential information about the Master of Public Health program. So firstly, who are we? UCL is one of the top 10 universities in the world, and we currently rank 6th in the world for public health. The Institute of Epidemiology and Healthcare, which hosts the MPH, is a really exciting institute and has a variety of expertise across loads of different disciplines, from population health sciences, as well as broader statistical expertise and collaborations with lots of other disciplines as well. We work in partnership with various other academic departments, but also with governments, with NGOs, other educational initiatives, and so on. And we do all of this because we're very, very dedicated in our institute to both research and teaching around population health theory as well as practice. So who is this program for? It's ideal for students who have an interest in the big picture and want to make a difference to the whole populations. So you might be a new or recent graduate in a health or science background, or you might have a lot of relevant work experience already, and you just want to build on that to take your career further to the next level. So it's really open to people with a variety of backgrounds. So you might want to know what distinguishes this MPH program above all the other programs that are out there. So firstly, you will gain core competencies in all of the core areas of public health. We've mapped our curricula against the UK Faculty of Public Health specialist curricula, as well as the ASFR WHO curricula for public health in the European region. We're going to develop your research and practical skills on this program, as well as wider experience around communication, leadership, advocacy, and so on. And we're going to cultivate your knowledge and skills to tackle a whole range of problems in population health. Now, we have 6 core themes which really underpin this program. The first is around interdisciplinarity. This is really key, as so many problems such as climate change, issues with the built environment and so on require a whole range of expertise. And UCL has at our fingertips a whole range of different experts across the university. The second core theme is around health inequalities. How do we measure them? How do we tackle them? How do we take action in real life to make a difference to marginalized and vulnerable communities and populations? And key to this approach is the involvement of citizens with lived experience as lecturers, teachers, sharing their experience to really understand public health problems from the perspectives of people who actually experience them and how to work together in a collaborative way to co-produce solutions. We also bring in the voices of practitioners. So we bring in lots of people with expertise in a variety of roles within public health, both in the UK and globally, so that you really get to know what it's really like on the coalface working with all of these different types of people. As I mentioned earlier, we focus a lot on core skills on this program. And by core skills, we mean everything from your epidemiology and statistics right through presentation, communication, and reflective practice. And all of these different themes serve towards achieving the final theme, which is about implementation, action, and impact. So this course isn't just about learning the theory of public health, but actually how are we going to practice this and make a difference in the real world. So what's the structure of the program? It's fully online, which makes it really, really flexible for people who might be working or have caring responsibilities and so on. You can do it full-time over 12 months, or you can do it part-time over 2 years, or modular flexible and take up to 5 years to do the program. It's a standard MSc or MPH program with 180 credits, 7 compulsory modules, 2 optional modules, as well as a dissertation project. And our approach to assessment is very varied. So we like to try to make things replicate as much as possible the types of skills, reports, and so on that you would actually need to do in your careers after you finish the program. So we've got, practical sort of work-based examinations, as well as written reports, presentations, as well as the independent dissertation project. So what does the MPH program journey look like? So we have 4 distinct phases on the program, but if you're part-time or flexible, you might go through these in a slightly different order, but I'll explain it for the full-time students just for brevity here. So in term 1, this is the foundation of your program. All these modules are compulsory or core, and you'll do the fundamentals of interdisciplinary public health, applied epidemiology, and statistics for public health. In term 2, this is the expansion phase of your program. Again, these are all core or compulsory modules. You'll do health improvement, theory and practice, health systems organization, economics and policy, health protection, and leadership management and communication. Finally, in term 3, this is your specialism phase of your program, and this is where you get to choose 2 out of 4 optional modules. So you might want to build on those core epidemiological and statistical skills you learned in term 1 by taking applied quantitative methods. You might want to, again, build on your skills from epidemiology and health protection and take applied infectious disease epidemiology. Or you might want to do something totally different and do qualitative mixed and participatory methods, or a very interdisciplinary module called urban health. Then finally, you bring together all of this knowledge in the integration phase of the program, and this is the dissertation. Again, this is core and is 30 credits, and we'll tell you a little bit more about this in the discussion at the end of this session. So what does a timetable look like if you're studying? So firstly, you're going to do a lot of asynchronous materials, which means materials that you complete in your own time, and then you will have a weekly live Zoom class for engaging with your module tutors as well as other students. So this is just a sample timetable where we teach on 4 days of the week, so Tuesday through Friday. And then for each module, you would choose either a morning session or an afternoon session, not both. These are replicated twice. And that's just because we're a very global cohort of students. We've got people living and working in lots of different time zones from across the world. And this enables us to have that flexible approach and make it as inclusive as possible for all the different students on the program. So what are the dates in this academic year? We start off with a welcome week for the MPH, which is the last week in September. You have term 1 from October to December, doing those core modules I explained. Term 2 is in January through March. And then we've got a bit of a break. And then term 3 is from the end of April to the beginning of June. And it's important to recognize that this is a full 12-month program. So we've got the summer MPH term as well from July to September. So if you had any deferred assessments or needed to resit something, you would do it during this period. And this is the main period in which you're working on your independent dissertation project, which is due at the beginning of September. So you might want to know what supports there are available, community building activities and so on for students and for building your careers. So we have a variety of induction activities before the program starts, so giving you information, but also a lot of different activities during that first welcome week. You'll have weekly contact with all of the module leads on the program, which is really, really fantastic in these live sessions, as well as office hours and, engagement on asynchronous discussion forums and so on. Every student is allocated a personal tutor, and they're there to support you academically, but also pastorally, and give you advice on your future career and so on. We've also got a dedicated MPH student advisor who's absolutely lovely and fantastic, and she will support you with your studies and any well-being needs or extenuating circumstances and so on that you might face. And just because you're online doesn't mean you don't have access to everything that's available at UCL. So we've got loads of career services, well-being services, academic writing support, alumni networks, and loads of other of services and supports in place. And of course, you'll be able to access any extracurricular activities which are offered online, either through the UCL Students' Union or the Institute, or just organized by MPH students themselves. In terms of the possible career destinations, there are so many different careers that you can do in public health, couldn't possibly list them all here. But you might think you want to work in a local level with your local community. Maybe you want to work in, say, national government, or even in international level with organizations like the World Health Organization or UNICEF or so on. This degree is really suited to people who want to work in maybe a service role, so as a public health officer, people who might want to work as, say, a policy analyst in government, either locally, regionally, or nationally. There's intelligence roles, so that's around using data, analyzing data, interpreting data, and so on for different levels in organizations as well. People will go on to research careers. So we've got a number of students who are applying for PhD programs after this, people who want to work in consultancy and healthcare, humanitarian aid, the list goes on and on and on. So I think, it's really exciting that there's a huge open door of career opportunities available to graduates for this program. So that's it for now. Just a bit of a whistle-stop tour. Do look at the prospectus. So just scan the QR code with your phone. Also, I put up the email address here. It's on the prospectus as well. And you can book a one-to-one appointment with either Dennis or myself and talk about your application and find out more about the program. And of course, you're very welcome to join us at one of our open days. So thank you for now, and we'll have a little bit of a chat now with Dennis and answer maybe a few more of the questions you might have.
Thank you for the presentation, Serena. I think that was a really good summary of our program.
Great, thanks. The one thing, though, I didn't really mention, and I think you're really the expert to talk about this, is a little bit about the dissertation. Students always are worried about this and want to know more about it. Can you just tell us a little bit about it?
Oh, yes, the dissertation. So the dissertation is an independent piece of research that every student has to complete by the end of their master's program. And I think one of the most interesting or exciting parts of the dissertation is that we don't give specific topics to students to work on, but we encourage students to bring their own research questions, their own topic to work on as a project. In previous years, some students brought topics from their current jobs or from their previous affiliations or anything that they are really interested in. And I think it does give an opportunity to work on something that they're so passionate about. On the other hand, we also know that coming up with a research question or a research topic is not an easy task. So we do provide lots of support in this. For example, there are one-to-one meetings between students and the module leads. We organize workshops where students have a chance to meet representatives of community organizations or public health specialists, so that they can develop better their ideas or even find colleagues to do a collaborative project with. So I think that's one important part or detail of our dissertation that everyone needs to know about. The other thing is that every student will be allocated a supervisor, a member of the academic team, who will help to carry out the project and do the analysis, help to write up the thesis. So students are not left on their own, but they are supported throughout the project. In terms of different types of projects, we allow or offer opportunities to do secondary data analysis or systematic reviews, policy analysis, public health evaluation. So really a wide range of topics are possible. And finally, maybe just to know that in terms of timing, most work or the bulk of the work of the dissertation work is done towards the end of the academic year, so end of the spring and the summer term when most students focus on their project. And maybe the last thing to say is that part-time and the flexible students will have to do their dissertation in the last year of their studies. So I think that's about dissertation. Maybe there is another thing that students are interested about and good to go into the details is whether there is any financial support that students can apply for or any funding that they can get in order to support their studies here with us.
Absolutely. This is a really, really important question, as you've highlighted. So our main scholarship for the MPH is what's called the Impact Scholarship. Now, this scholarship is available for 2 people who've got experience of inequalities in some sort of way. So we're quite broad in how we define that. So anybody who might have financial difficulties, for example, or who may have experienced discrimination or other issues related to inequalities in their life. And then for those people to talk about how they're going to use that experience of inequality to really make a difference in public health. So how to have that impact in their home country, in the populations that they live in. So those 2 scholarships are very generous. They cover the full cost of the course. And as I said, there's 2 of them available. There's also a range of other scholarships available at UCL. So there's a UCL scholarship finder, which you can go online, and lots of people have different types of scholarships that they can get through that. And they're available to both UK students as well as international students. So quite a range, and it's definitely worth looking early and seeing what's available to your particular circumstance.
In terms of the Impact Scholarship, is this available for part-time and flexible students as well, or is it just for full-time students?
Yeah, so that's also a really good point. So the amount of the scholarship is fixed for the value of the fees that are for this year's cohort. So if you're part-time or flexible and you're going to do it over a number of years, you still get that same fixed value. And if the cost of the course increases over the number of years it takes you to complete your master's, then you might have a small shortfall towards the end of your course. So it will cover the full-time fees for those students for this year.
I see. So maybe another thing that perhaps good to talk about and make students aware is the range of colleagues or teachers, lecturers who talk in or teach in our program and cover in our teaching. And in that aspect, I would say that I think it's one of the strengths of our program.
Absolutely. There's so many different people that teach on the program.
Yeah, I mean, we have a good, very experienced core MPH team that includes the 2 of us plus 4 other lecturers, and we organize many of the modules, we run the sessions, and organize also the assessments in many of the modules across the year. But apart from this core team, we also take advantage of the vast amount of experience and knowledge that is available here at UCL. So many professors, lecturers who work here at the Institute of Epidemiology and Healthcare or other parts of UCL do teach in our course. Some of them lead modules.
Yeah.
Some of them come as guest speakers to talk about their particular field, because in fact some of them are global leaders in their particular field. And I think, just as a last note on this, there is another group of colleagues who come and teach with us, those who even beyond UCL, beyond academia, for example, people with lived experience, and public health practitioners who also join in various sessions and share their experience with the students.
I think that's a real strength of our program, actually, and what makes it quite unique compared to a lot of other programs that are out there is this incorporation. I talked about a little bit in the presentation about this incorporation of the lived experience and the practical expertise. I know in my health protection module, for example, we bring in different practitioners every single week, working in UK settings, global settings, and responding to all kinds of health protection emergencies all around the world. So it makes it really applied, really practical, and really focused on giving students quite a broad education with a focus on the sort of careers and core skills later.
Yeah, absolutely. And then also maybe just to add that the interdisciplinary nature of our program is so important, and these colleagues who come to teach with us from within UCL or beyond, they come from various disciplines and bring in that interdisciplinary flavor, which is again one of our core themes in the program. So maybe here in the final part of this video, Serena, would you like to say a few words about the achievements of this program so far? Because we are still a new program, but we have reached some achievements which may be worth mentioning.
Yes, well, I mean, we should be proud. We're only in our second year at the moment, and if you're watching this video, you're interested in joining us, I guess, for our third year on the program. And already we've been recognised by the university. So we won the faculty award for the best prize for digital education initiatives in our faculty, and then that won us a runner-up across the whole university in all the different programs for the Provost Award. And then recently, just before Christmas, we also won the faculty Best Team of the Year award, which I think is great. It's really fantastic. It's a fabulous team to work in. It's we've got a great team of colleagues from all over, as we've been describing, and I think that really adds to the environment and the enjoyability for students to be part of a team that is that cohesive and working together in such a collaborative way. So thank you for listening, and I really hope that you'll join us on the MPH. And if you have any questions, do get in touch. We'd be very happy to answer any questions or to have a one-to-one meeting with you to talk about your individual applications. And we really hope to see you on the MPH next year. Thanks very much for listening.
Thank you for listening. Goodbye.